When I was volunteering as a candy striper, my assignment was in the emergency department. And I had never known what nurses do. And when I watched how central nurses were to the care of patients, their assessments, their judgment, their interventions, their caring for pain, suffering, communicating with families, treating trauma patients. In a moment, they were spectacular. And they taught me a lot. I had planned to be a teacher, and I thought that that was the direction I was going. But after working and watching through that volunteer experience and working as a nursing assistant, there was no doubt that I could play a role, and I thought that I could be successful as a nurse. We can only improve health by partnering with the community. So I think that one of the things we can do is really staying very grounded in the community to understand the issues, problems, the social determinants of health, and really designing health interventions, our community interventions with our communities, and assuring that we continue to push for an expanded scope of practice for nurses, both baccalaureate nurses and advanced practice nurses, so that we make sure that the people of Indiana get full use of the nurses that have graduated from Indiana University. I do think in terms of engaging the alumni and making sure they know what's going on in the school, that we have to continue our fabulous outreach and continue the communication to the alumni about what's happening in the school. And listening to the alumni, because they are out in the community, they're listening to what the community needs are, they're witnessing our students in the community no matter where we are. So we need to hear from those alumni and help us understand how we can be better and strengthen our own programs to create that future together. We conduct research studies. They begin to distinguish between evidence-based practice and research, and they begin to see their role as they professionally develop. So beyond the statistical significance, which is great for a researcher, we also find that it's really about partnering with patients and partnering with nurses to promote better care. They become partners for life, quite honestly. So I'd say we will study any intervention where nurses can make a difference and learn how to best implement those interventions in practice, measuring the impact to patients. I think there are any number of ways that donations can be used to enhance the practice, to enhance research, to support our students, that then the whole goal is to give back to the community and improve the outcomes. So I think that one of the most treasured gifts that a student can receive is a scholarship. One of the most incredible honors that a faculty can receive is an endowed chair or an endowed professor. And the work that they can do as a result of that will give back to the community for generations. When I think about myself, I see myself as not being top down. I see myself on the bottom, just like we do our research studies. What we do as leaders is informed by what's important to practice. But from a philosophy standpoint, I think that I'm completely grounded in what patients need. And I can't think of a better place to be than Indiana University.